Class 3, Preparation for Breastfeeding. It's one of the first questions asked by mothers when they choose to breastfeed. What do I need to do to prepare for breastfeeding? For many years, women were told that if they were planning to breastfeed, they needed to toughen their nipples by rubbing the nipples daily with a rough towel. Can you imagine how that felt? All that did was rub off the protective substances that the body makes to prepare itself for breastfeeding. Research shows that a mother's body does a wonderful job of preparing itself for breastfeeding. Oils and protective factors are produced to help keep the nipples clean and the skin supple. When it comes to preparing, the best thing you can do is learn as much as you can about breastfeeding and how it works. Your body has all the essential equipment that's needed to breastfeed successfully, and it begins preparing as soon as you're pregnant. Your breasts enlarge, the glandular tissue inside grows, the nipple and areolar skin darkens, and the Montgomery glands, the bumps on the areola, enlarge and secrete oils which protect the nipple. Your body is made for birthing and breastfeeding. Your body grew your baby, and just as wonderfully, your body can feed this baby. Lots of times, mothers have questions about their ability to breastfeed. Talk to your care provider if you have any specific questions. The big question most women have is, will I be able to breastfeed? And the answer, almost 100% of the time, is a resounding, yes, you can. Breast size doesn't matter when it comes to breastfeeding success. Women with large and small breasts can breastfeed successfully. The same is true for those women with inverted nipples and for mothers who give birth by cesarean section. Every day, mothers go to work and continue to breastfeed. And even if your mother, your sister, or your friend had a less than ideal experience, you can successfully breastfeed. A pinch test will allow you to understand how prepared your nipples may be for breastfeeding. Take a look at your breast to do the pinch test. Put your thumb on the top of your areola, your index finger underneath the breast, and compress the tissue. If your nipple sticks out, that's great. If it goes inward or flattens completely, then your nipples may be inverted. Talk to your doctor or midwife if this is the case. Here's a video of a nurse helping a new mom perform a pinch test. You don't have to do much physically to prepare for breastfeeding, but it's a huge help if you prepare emotionally by building your confidence. Learn all you can about the process. Talk to mothers who have successfully breastfed. Get on blogs and forums. Talk to your healthcare provider. And know that not only are babies born to breastfeed, but your body was made to make milk. Learning to relax. Breastfeeding is a learned skill for both you and your baby. It takes time and practice to get comfortable breastfeeding. Some babies and some mothers just take a while to perfect the skill. Remember, your baby has never had to work for his food before, so try not to get too stressed in those first few days. Don't worry whether the baby is getting enough or if the baby has lost some weight. Trust the process. It's worked for thousands of years. Developing patience. In the beginning, nipple size and aversion can sometimes be a challenge to breastfeeding, but with a little help and patience, babies will learn to breastfeed. If you need encouragement or advice, talk to your healthcare provider for assistance. In the beginning of your pregnancy, start reading about everything that's going on with your body. Begin thinking about your care provider, where you want to give birth, and who you would like to care for your child. You have choices when it comes to who you want to care for you during your pregnancy and birth experience. You should interview your provider, ask a lot of questions, and make certain he or she has a philosophy of care that agrees with yours. There are obstetrician-gynecologist physicians, or OB/GYNs, who specialize in the care of women and the diseases that affect them. Some family practice physicians, or FPs, care for the whole family throughout the life cycle. Not all family practice doctors care for women during pregnancy, labor, and delivery, so be sure to ask ahead of time. Certified nurse midwives, or CNMs, are formally trained in nursing and midwifery and are licensed in all states to care for women throughout their life cycle. They attend births in hospitals, birth centers, and sometimes in the home. Providers who recommend childbirth education classes which focus on birth experience can be more receptive to mothers playing an active part in their labor and birth. Women should be aware that there are different alternatives for pain management in labor that do not involve drugs or anesthesia. Make sure your chosen doctor or midwife supports you and your choices regarding labor and birth. Confirm that your healthcare provider supports the practice of placing babies skin to skin immediately after birth. This is a practice which has been found to ease the transition from baby being in utero to life in the outside world, even for mothers having C-sections. Your baby's birth is an experience you will remember for the rest of your life. You want to give birth in an environment where you feel comfortable, safe, and confident that your needs and wants will be respected and honored. Some facilities, hospitals, and/or birth centers are more supportive of the birth process and keeping the mother and baby together to enhance breastfeeding. Based on your insurance coverage, you may not have a choice where you deliver. However, these are the essentials to get breastfeeding off to a good start. Hospitals and birth facilities that are designated baby-friendly have gone through rigorous training and practice development. Their nursing staff has received education credits in breastfeeding support, and you can be assured that your breastfeeding will be supported throughout your hospital stay. Only about 4% of hospitals in the U.S. have been designated as baby-friendly, so there may not be any in your area. You can still find a facility that will respect your wishes to get your breastfeeding off to the best possible start. Talk to your doctor or midwife, childbirth instructor, or the nurse manager of the unit where you are considering delivering. Tell them you're interested in having your baby at their hospital, and you're interested in how they support breastfeeding. It's getting close. It's almost time for your baby to make his arrival. This is an exciting time for you. In addition to discussing your birth plan and preferences with your doctor or midwife, you will want to choose a healthcare provider for your baby. By now, you've probably made your decision regarding how you want to feed your baby, and you'll want to find a pediatrician who supports your decision, is medically capable, and supports your parenting style. Consider making an appointment before you deliver to ask questions. Ask them how they support breastfeeding and for a list of available resources. It's true, you've got it all. In a normal situation after a healthy birth, to be successful with breastfeeding, all a mother needs is her breasts, her baby, and a lot of support from hospital staff, her family, and friends. Some women choose to purchase some breastfeeding aids to help make the experience a little easier. These can include a breast pump, breast care, a pillow, a nursing bra, a baby sling, and a nursing gown. So to review, it's helpful to be prepared for breastfeeding by learning as much as you can about the process, choosing a supportive care provider and birthplace, discussing your birth and breastfeeding plans with your obstetrician, and knowing your breastfeeding support team. In our next class, we'll talk about the process, how breastfeeding works.